With hospital staff and resources stretched thin, schools struggling to stay open, and COVID numbers the highest they've ever been in Massachusetts, lawmakers pressed Governor Baker today on what he and his administration are doing, and more importantly, what they believe he is not doing to keep people safe, pushing for action on more statewide guidelines and mandates.
I can't say to the hospital folks, hey, listen, we're the best and we're better than any other state in the nation. So we should be okay. That does not help them. So I think there is an enormous amount more that we can do. So I'm asking you, can we look at this and can we do something with the sense of urgency that it deserves?
It was the governor's third time testifying about his handling of the pandemic before the legislature's Joint COVID Oversight Committee, testimony that came just a few hours after his announcement that the state has signed a contract to bring 26 million rapid tests into the state over the next 3 months, although he hasn't yet said how he plans to distribute those, except to note schools and childcare will be the top priorities. And he acknowledged in the hearing it's possible that supply chain concerns could mess with that timeline. Baker also highlighted to committee members the state's new digital proof of vaccination website, which launched yesterday, by the way, and lets people download a virtual vaccine card with their information and a QR code showing any COVID vaccines they've gotten in the state. And he noted new guidelines from the state's Department of Health recommending people who've been exposed to COVID get tested 5 days after they were exposed or started showing symptoms. The problem? Just a recommendation, and while the digital proof of vaccination is a welcome development, it's only useful if businesses actually check them. But when committee members asked about mandating things like vaccines or masks to Health and Human Services Secretary Mary Lou Sudders, she had this to say.
We're not inclined to do a mandate.
A response that prompted these closing words from one of the committee's co-chairs.
When we as a state don't take the responsibility that we need to take with regard to mandates, which can be very unpopular, I worry for our local officials.
That co-chair, State Senator Jo Comerford of Northampton, joins me now along with fellow co-chair, State Representative William Driscoll of Milton. Senator, Representative, good to see you again. Thanks for your time. I appreciate it.
Thank you.
Thanks for having us.
Start with you, Senator. Before you share where you think the administration is falling short, could you each pick one major area where you think the Baker administration has gotten it really right on COVID? Senator, starting with you.
Thank you so much. Well, first, in the beginning of the pandemic, there was a lot of very targeted, pointed, strategic, tireless work that happened to address COVID-19 head on. And just as you mentioned in your introduction, just before this hearing, there were some very necessary steps, including 23 million or 26 million rapid tests that are going to come into the Commonwealth, which I think we'd all agree is so much more necessary than the initial bout of those rapid tests that just were insufficient to meet the numbers and demand.
Well, and by the way, he's doing a hell of a lot better at procurement of tests than the President of the United States is doing, I should say, so far. Representative, how about, if I remember correctly from early last year's hearings, you all were quite critical of the governor's vaccination progress. We're one of the handful of most vaccinated states in the country, with the inequities having smoothed out to a serious degree. Has the Baker administration handled that as well as the numbers suggest, or no?
Yeah, to your first question, I think one of the places that the administration's done well is the pivots from the early vaccine rollout, lumpiness and bumpiness. We set a goal early on to get to 4.1 million vaccinated people. We hit that on June 22nd. What we're missing right now is a goal for people getting up to date with their vaccines. We've got a couple million people that are eligible, could get a booster today. Yeah. We've got only 44% of kids 5 to 11 vaccinated right now. I'd love to see us set some goals that practitioners and public alike can work together to meet so that we get out of this pandemic sooner. And I think today was productive in terms of demonstrating the purpose of the COVID committee. The administration acted on the things you mentioned at the top of the show, just in the past 48 hours. I was thinking about asking the governor if he wanted to make any more announcements before we got started today. But I think we got answers to several of our questions today. It was important, and it'll help inform our actions in the legislature going forward.
Well, I don't know this to be a fact, but I would guess that the scheduling of your hearing didn't do anything but help speed those announcements. Representative, staying with you, I think viewers know this and my radio show are mandate central, so I should be fully transparent. We believe in mandates in crises like this. I'm assuming you both believe, am I right, that there should be a mask mandate statewide? Is that, you're nodding, so I assume the answer is yes? Is that correct?
Yes.
Okay, then Representative, when that issue was broached with Secretary Sutters and or the governor today, what explanation is there for not doing what almost every single public health official I've heard suggests is the right thing to do?
Yeah, I think that coordinated collective actions like a statewide mandate, like a statewide goal for vaccinations for adults and kids, I think those are important actions. And when they're done collectively in a coordinated fashion, we know that we can get things done. I think the secretary was also correct, though. A mask mandate alone will not end a surge. It can prevent a surge. It can slow transmission. But we need to do, again, coordinated approaches. That's how we either prevent us from getting this to this point or help us get out of them.
Well, why shouldn't there be, Representative, why shouldn't there be a vaccination mandate statewide, not unlike the one that exists in Boston as of Saturday? You want to go into a performance venue, you want to go to a gym, you want to go to a restaurant, you're vaccinated or else you don't go.
I think it's a completely fair question and one that I talk to my colleagues about often. People from around the state are in different places on this. And I think as we continue to see the efficacy and the safety of the vaccines proven with each shot given, as they are shown to be proven safe, I think we'll get there someday. It's not going to happen tomorrow like I'd like to see, but there's a lot of good data out there and it continues to get better. And if you look at right now, folks are if you're fully up to date with your vaccinations, your likelihood of ending up in the hospital or severe illness is cut dramatically down.
One of the arguments, Senator, correct me if I'm wrong, I don't know if this was voiced today by the administration, that you hear opposed to mask mandates is, well, the key issue is get vaccinated. But I think I have the numbers right. In this state, in the last week, the number of breakthrough infections was more than, I think it was 13 or 14,000 on average a day. There were 112 deaths, I think, in the past week from breakthrough infections. Again, for those who don't know the term, fully vaccinated people. Doesn't that sort of undercut the argument that it's all about vaccinations and mask mandates just aren't that important?
It absolutely undercuts it. We of course have to lean in as a state, with public health officials to the messaging and the belief in the efficacy, as the chair said, of vaccinations. But we can't for a moment think that all we have to deploy is a vaccine mandate or a vaccine rollout in order to get the kind of efficacy in terms of meeting this Omicron pandemic head on. We must have a vaccine plus mandate, and that would include, I think, universal mask mandate for targeted indoor spaces and a targeted vaccine mandate for some larger venues like nightclubs and stadiums and theaters, things like that.
I want to return to the mandates in 1 second, but quickly, if I can, starting with you, Senator. Emergency rooms bursting at the seams in lots of places in the state. Small businesses, including lots of ones I patronize in my hometown of Cambridge, hanging by a thread, if that. Is the administration doing enough? Is the legislature doing enough on both of those fronts, Senator, to keep emergency rooms safe, to keep the staff from going out of their minds, and to keep small business owners afloat?
So two very different things. I think they certainly talk to each other. With regard to emergency rooms, no, we're not doing enough as a state. We need to slow the wave of Omicron. We need to stem that spike and shorten the curve. We need to do that because even though, as the governor said repeatedly during today's hearing, that Omicron doesn't make us sick unless you're unvaccinated, totally understand, it does break through, as you're saying, and it has caused people to enter the hospital who aren't who wouldn't imagine to be at risk if they were fully vaccinated. There are these cases and they are tipping the scales, and our hospitals are depleted, they're understaffed, and workers are exhausted. And so we have to do our best to meet this pandemic head on right now.
How about small businesses quickly? Is there more help coming from the state?
I do think there should be more help coming from the state. Certainly, the legislature has joined together House and Senate for small businesses. I think we can do more and should do more. I also think that uniform state guidance will be of huge help to local communities, because otherwise they're going to have a mask mandate in one community and not a mask mandate in another, and that could disproportionately burden a small business.
Representative Driscoll, I may have said this to you last time we were here, and this is the one thing I just don't get. If you in the legislature are unhappy with the fact that the governor, for example, won't do a mask mandate, if you're unhappy that the governor won't do a targeted, as the senator said, vaccine mandate, why don't you do it? It's an overwhelmingly Democratic legislature. If the governor didn't like it, you could override his veto. Why don't you do a mask mandate tomorrow? Why don't you do a targeted vaccine mandate tomorrow?
Yeah, thanks, Jim. This question comes up a lot. And, really the way that we look at it is the legislature is a deliberative body. We're involved in the recovery process and figuring out the policy and where the rescue plan money goes, as we've done with $200 million that we gave to the administration back in June of 21 for this very day, for if there was a variant surge or other public health crisis related to COVID-19. The executive branch is really the day-to-day operations manager for the Commonwealth. They're in a position they can make quick decisions and act with the departments to put those things in place. And so we're looking at, again, your question about small business, a question about hospitals in the long term, how we're going to come out of this, because I'm really concerned about the damage that's being done to the hospital workforce, the healthcare workforce, industries like that.
I only have a minute left. I'm sorry. Respectfully, I understand what you believe the role of the governor to be, but if you don't believe the governor is doing that which you believe is necessary, isn't it incumbent on the legislature to fill the hole? And I only have 30 seconds, Representative.
I think today is a great example of what the point of the committee is, to have public accountability, which is important, to talk through these questions and answers with the governor and his team. And we'll continue to do that. It's really incumbent upon them managing the Department of Health to make those statewide decisions. And we'll continue to support local municipalities, regardless of what the decisions end up being.
Well, if they don't do it, he doesn't do them, I hope you do. Senator and Representative, I'm glad you're holding hearings, and I'm really glad you made time for us tonight. Thanks so much. Appreciate it.
Thanks, Jim.
Appreciate you.